Revolutionizing glaucoma surgery with the ultra cost efficient MIGS, the technique of MSICS with bang. As the quest for a safe and effective surgery for glaucoma continues, MIGS has added another armor for the battle against glaucoma. MIGS bridges the void between medications, lasers, and glaucoma filtering surgery. Minimally invasive glaucoma surgery uses an ab interno approach and it is minimally traumatic. It offers modest efficacy, extremely high safety profile, and a rapid recovery. In the last 2 decades, we are witnessing the advent and the rising number of MIGS procedures, which is expected to rise more in the future. A multitude of MIGS procedures, including device-based and non-device-based procedures, are currently being performed worldwide. So, what is the scenario in India? The uptake in India has been rather slow due to limited availability and economic constraints of the device-based MIGS. BANG or the bent ab interno needle goniectomy is a MIGS procedure which is not expensive and does not require any sophisticated instruments. It can be performed using a readily available bent 25 gauge hypodermic needle. Usually, bang is performed along with phacoemulsification. To make it ultra cost efficient and readily available, we performed bang along with the most commonly performed cataract surgery in our country, the manual small incision cataract surgery. The most important prerequisite for any MIGS procedure is to perform a good intraoperative direct gonioscopy. In this video, we intend to share our tips and tricks for a great direct gonioscopy and also our technique of MSICS with bang. A well-prepared battle is half won. Surgeon should make himself ready before MIGS by performing gonioscopy in the clinic and looking for landmarks and prior intraoperative practice. Patient selection is another key. Ensure that the patient has visible angle, good cooperation, no head tremors, and adequate neck mobility. Precise intraoperative positioning is equally important. Rotate the microscope 30 to 40 degrees towards the surgeon. Rotate the patient's head 30 to 40 degrees away from the surgeon and ask the patient to look ahead. Goal is to achieve an en-face view in which coaxial light enters parallel to the iris and points to the angle. Position the OT table in a reverse Trendelenburg position with head above heart level. This helps to prevent blood reflex from Schlemm's canal. For docking the gonio lens, hold lens with the non-dominant hand. Place and rest the palm on patient's forehead or cheek based upon laterality. Before starting, try to identify the landmarks. Scleral spur and blood in Schlemm's canal are 2 important landmarks. Compared to phacoemulsification, MIGS has less working space around 0.77 mm in the angle. Also, the working distance of the surgeon is increased. Simultaneous extraocular and intraocular manipulation is needed. Corneal folds may distort the view. In this case, add adequate viscoelastic, avoid pressure on the gonio lens and check for wound tension. If the vision still remains blurry, check for the proper zoom, accommodation of the surgeon, conjunctivochalasis, bubbles and corneal edema. Now we are all set for bang. A 25 gauge hypodermic needle is bent. A temporal clear corneal incision is made. The anterior chamber is filled with viscoelastic after positioning the patient and the microscope. Viscoelastic is applied over the cornea. Adequate positioning is ensured and the direct gonio lens is placed. Proper en-face view must be obtained and identify the structures. Then the bent needle is introduced and approximately 100 degrees of the nasal trabecular meshwork is then excised. After completing the bang procedure, the surgeon shifts superiorly and performs the manual small incision cataract surgery. Filling the chamber with adequate viscoelastics can stop the blood ooze and ease the visualization. Studies on the outcomes of bang has shown significant intraocular pressure reduction and drop in the number of anti-glaucoma medications. To conclude, appreciation for the risks and complications associated with traditional glaucoma surgery has ignited the mixed revolution. Bent ab interno needle gonectomy with a manual small incision cataract surgery is a promising procedure that represents an easily accessible and ultra-economic MIGS option.